Hey, welcome to Gut Savior. This is Dr. Sal. I like to talk about disorders of the gut-brain interaction. So, irritable bowel syndrome, it's one of the DGBI or the disorders of the gut-brain interaction. Other forms are functional dyspepsia, functional abdominal pain disorders. So, what are the disorders of the gut-brain interaction? What does it mean? DGBI refers to the disconnectivity or disconnection between the gut and the brain. The gut and the brain are always interacting with each other through dense nervous tissue. Gut is the second most enriched nervous tissue after brain. No wonder all these proverbs that have come throughout centuries about gut feeling, gut-wrenching experience, that something is off, even before your brain has had a chance to process that information. The gut knows something is not right when you hear bad news. So what happens is, our current understanding is that DGBI occurs when the brain and the gut are not in harmony. And the major player in all this is the gut microbiome. 100 trillion rich microbes inside your gut, compared to only 35 trillion cells in your whole human body. 3 times more bacteria are living in your body than your own cells. So that tells you that this rich microbiome is playing a major silent role in your health, not only just gut health, but in your brain health, in your heart health, in your skin health, and in gut, of course. These quiet trillions of bacteria are always at work. What are they doing? They are digesting the fiber that you take into fermented products. And those special products, those molecules that come out of this fermentation of oligosaccharides, are short-chain fatty acids, lactic acid, bacterial killing, bacterial killing agents, bacteriocins we call it, or antimicrobial agents. They are all secreted, and they somehow help the whole body. They fix your leaky gut. They create anti-inflammatory molecules to cut down on your inflammation. They reduce your chances of heart disease. They reduce your chances of colon cancer, and boosts your immunity, and manages your blood pressure and blood sugar. So many things are happening with these microbes. All you need to do for them is to eat enough of soluble fiber, which is prebiotics. So what makes you prone to these DGBI or the disorders of the gut-brain interaction? Many things, even at the time of pregnancy. If it's a stressful pregnancy, if there is early use of proton pump inhibitors in small babies, early use of antibiotics, psychological stress of the mothers, financial stresses in the families, and early infections of some kind. They all lead to priming your gut into becoming more sensitive in the future. And this leads to a series of changes, creating more pro-inflammatory kind of cytokines and molecules in your body that lead you to eventually present in a visceral hypersensitivity mode of your gut. And that hypersensitivity of your viscera, which is your intestines, is what we call irritable bowel syndrome, or functional abdominal pain disorder, or functional dyspepsia. So yes, irritable bowel syndrome is itself not one condition. It's a spectrum. It's a broad spectrum, and it can be of so many varieties. Important thing about irritable bowel syndrome is that there is disturbance of bowel movements along with the pain or discomfort of the abdomen. If your bowel movements are regular, there is no diarrhea, there is no constipation, there is no change in the frequency or the form of the bowel movement, you just have pain, it is not irritable bowel. Irritable bowels itself is defined as change in the form or the frequency of your bowel movements along with abdominal pain or significant discomfort. And it has to go on for more than 2 months, and it occurs at least 4 times a month. and there are no other pathological, metabolic, infectious, or other reasons to explain. That means the diagnosis is not something you can do by yourself. It is not something that anybody can make a diagnosis of irritable bowel syndrome. It has to be methodical, and it has to be done by a very well-informed gastroenterologist, a board-certified gastroenterologist who has been dealing with disorders of the gut-brain interaction. So, what the gastroenterologist will do for you is to find out if there are other ways to explain your changes in the bowel movements and your abdominal pain, because there are other conditions that mimic IBS or irritable bowel syndrome. What are those conditions? You can have celiac disease, which is a gluten problem. Your body reacts to gluten, and it's not just gluten sensitivity. Celiac disease is actual problem with gluten where your intestines are damaged. There is a condition called villus atrophy, which means the absorptive surfaces in your intestines are damaged. They are not very nice gracile, finger-like projections that absorb all your food. They are chopped off and they are not absorbing micronutrients. So that's celiac disease, and you diagnose it by endoscopy, and you diagnose it with a simple blood test where you look for antibodies, anti-tissue transglutaminase antibody, or simply anti-TTG antibody levels, and you look for immune globulin A. So those are some of the tests you do, and then with the endoscopy, when you see that the biopsy or the microscopic study will tell you with the samples taken during endoscopy that these villi are shortened and there's a lot of inflammatory cells in your biopsies. That will make a diagnosis of celiac disease, and then you go on a lifetime of gluten-free diet, no cheating, complete gluten-free diet. So that's your diagnosis of celiac disease. But the presentation could be very similar to IBS. You can have diarrhea, you can have constipation, you can have cramping, you can have abdominal pain. So it's important to make sure the gastroenterologist rules that out. Then the gastroenterologist will consider doing colonoscopy to make sure you don't have inflammatory bowel diseases, you don't have colon cancer. Those things have to be taken into consideration depending on your age. In children, we don't jump into colonoscopies right away, but if you're an adult, you have a risk of colon cancer, so you have to be prepared and gone through the colonoscopy and endoscopy depending on your symptoms. Then there's a condition called gastroparesis where your stomach is lazy and it's not emptying really well. But with that, you can have SIBO, which is small intestinal bacterial overgrowth. If you have bacterial overgrowth of your small bowel, remember small bowel are thin, colon is big. In the small bowel, if there's a lot of bacteria, there shouldn't be very many bacteria in small bowel. Colon is where most of the bacteria live. Majority of them are healthy, gut-friendly bacteria that live in the colon. But small bowel do not have much bacteria. But if there is some way there is a lot of bacteria there and there is overgrowth, then they produce a lot of air. And small bowels are thin, they cannot be stretched much. So a little bit of gassiness in there can produce your bloating, and you may have symptoms of bloating and gassiness and discomfort. You may have diarrhea. Then you have to make sure it's not SIBO, because that is treated differently. You give antibiotic treatment for that, you change your diet and all that. But with irritable bowels, sometimes SIBO can also happen with irritable bowels. So a good gastroenterologist will be able to discriminate and differentiate based on the symptoms, and also make sure they're not missing one for the other. So just like my mentor used to say that some dogs have both ticks and fleas. So granted, we try to explain all the symptoms with singular diagnosis. Some people can have more than one diagnosis. So that's the story about irritable bowel syndrome.